everyone will be fine. Today I came with a new topic. That topic is known as, the new topic today is Erythroblastosis fetalis. Here I will write Erythroblastosis fetalis. So today's topic is Erythroblastosis fetalis. Erythroblastosis fetalis is a very important topic in pediatric, in case of medical surgical nursing, and in case of genetics also is one of the main and most important topic. In Erythroblastosis fetalis, I will take this in very simple. I will explain Erythroblastosis fetalis in a very simple way, not in a detailed way, and just within 10 minutes I will complete this. And I will explain the core concept of Erythroblastosis fetalis. Actually what happens that we all know about the genetics. First of all, how it happens, that are when there is possibility of Erythroblastosis fetalis. First, before going to the topic, at the end you will understand what is Erythroblastosis fetalis. First I will explain that in our body, in addition to A-B-O system blood grouping, there is a blood grouping in our body, that is A-B-O system. A blood group, B blood group, AB blood group, and O blood group. And in these there is AB, and no antigen respectively. That means, so there is A antigen on RBCs. So first we know that in our body there are biconcave cells in the blood. Those are known as RBCs. Those RBCs are having antigens. If they are having A antigen means A blood group, B antigen means B blood group, C antigen means C blood group. So like that, AB antigen means AB blood group, O antigen means no zero, and no antigen means no zero, O blood group means O blood group. That is ABO system. There is one more antigen on the body, on the RBCs. That antigen is called as D antigen. That antigen is called as D antigen, and this D antigen is also called as this D antigen. This D antigen, if the person is having D antigen, the person is called as Rh positive. So that's why we can call it as Rh antigen, because it was found in the rhesus monkeys first. So Rh antigen we can also call it as Rh antigen. So those who are having Rh antigen on their RBCs, they are called Rh positive, and those who are not having are called as Rh negative. Now I will go to the topic. What happens if the mother, so here I am going to explain, this is a mother and here is a father. What happens? The mother is Rh negative. The mother is Rh negative, but father is Rh positive. Father is Rh positive. During the first birth, during the first pregnancy, and at first birth, the baby will be Rh positive. The baby will be Rh positive because father is Rh positive. Now what will happen? That this Rh positive, this is the first child. This is the first child. First child is Rh positive. Nothing will happen here. Now what will happen if in case there is a mixture of blood? If in case blood mixed from what? From fetus to mother. Sometimes what happens, due to the error during the procedure, or due to the any other error, or in case of other conditions, what happens, there is a chances, or during the cutting the umbilical cord, there is a chances that mother's blood and fetus blood can meet. How it meet? That some of the cells, some of the blood RBCs will enter into the mother's body. Now once the mother's body receives these Rh positive RBCs, what happens? Already mother is Rh negative. Mother's immune system doesn't know these RBCs, and when mother's immune system is not knowing about these kind of, because when it is having A antigen means here D antigen, when D antigen is present, it means mother is not having this D antigen. Definitely mother will make antibodies against this antigen. So what happens? Now mother will start form antibody, that is IgG. Antibody is that? That antibody is called as IgG. And remember, IgG is the only antibody that can cross placenta during the pregnancy. Remember. So IgG antibody is formed against fetal RBCs. Now, what happens during the second pregnancy? During the second pregnancy, already mother is having IgG antibodies against those RBCs. What happens? These IgG antibodies are normally crossing the placenta. What happens? They will cross placenta. And they will start destroying these fetal RBCs. Means second pregnancy child. Second pregnancy fetus. Remember, they will cross placenta and destroy fetal RBCs. When fetal RBCs are destroyed, remember, when fetal RBCs are destroyed, what will happen? More and more immature RBCs are being produced. Immature RBCs production increases. When immature RBC production increases, and what will happen? Because there is a counter current mechanism. When RBCs are destroyed, body has to make more and more RBCs. So the second pregnancy fetus is forming more and more RBCs, but those RBCs will be immature. So what will happen? Immature RBCs are formed, and what liver will do? Liver will destroy the immature RBCs, the excessive RBCs formed. Liver will destroy these. So fetal liver will try to destroy these. Okay, and at the same time, liver and spleen has to produce the RBCs. So immature RBCs are produced by liver and spleen. By liver and spleen. And at the same time, that liver has to liver and spleen. But we all know that spleen is the graveyard of RBCs. Spleen will destroy. Liver formation occurs in the liver and spleen. But spleen is a graveyard of RBCs. So when there is excess of RBCs in the second fetus, so the fetal spleen will try to destroy these immature excessive RBCs. So what will happen? Spleen of fetus will destroy these RBCs, these excessive RBCs. So when the spleen of the fetus will destroy excessive RBCs, I will write here what will happen. What will happen? That there is chance of liver failure. Because there is overload on the fetal liver. When there is overload on the fetal liver, there are chances of liver failure. When there is chance of liver failure, remember, the liver functions will alter. This is the main point. The liver functions will alter. How liver functions will alter? Liver has one role. That is formation of proteins like albumin, globulin. Most of the proteins are formed in the liver. So albumin and other proteins are formed in the liver, and these proteins have role in the osmotic and oncotic pressure. So when there is liver failure, the albumin protein will not be produced excessive. The albumin protein will not be produced. When albumin protein and other oncotic and osmotic proteins are not produced, the osmotic and oncotic pressure will decrease. So there is a decrease in oncotic and osmotic pressure that leads to the edema. We all know there will be the edema. The fluid will accumulate in the fetus, and that accumulation of fluid in the fetus will cause a major complication that is called as hydropus fetalis. Hydropus fetalis means there will be excessive fluid accumulation within the organs of the body of the fetus. That is hydropus fetalis, the complication. So three things will happen. There will be anemia in the fetus, mild complication. Then there will be hyperbilirubinemia. bilirubin will be produced more and more because more RBCs are produced. Okay, so bilirubin will be produced more. So RBCs will produce what? Bilirubin. So that bilirubin will increase in the fetus. That is hyperbilirubinemia. And last complication will be hydropus fetalis. That is edema within the body or within the fetus. That will cause the excessive swelling of the fetus. Okay, this was the main mechanism of erythroblastosis fetalis. What is the signs and symptoms? You can easily find signs of symptoms here. I have told anemia, hyperbilirubinemia, and hydropus fetalis. The complication is there, and we can find how we diagnose this. There are a lot of diagnoses are there. I will, if I got time, next lecture I will take and I will define those also. But this is the main. You can see in the books also diagnose everything. That is very easy. But this is the main thing. This is the main thing. This is the mechanism of erythroblastosis fetalis. And here, what will be the management? Management we will go. Most important management that we all know is ROGAM. ROGAM is called as anti-D. Here is an D antigen. So anti-D antibodies we are giving. One of the main injection is injection ROGAM that we give to that we are giving to the mother, so that so after the first pregnancy, so that in the second pregnancy there will be less chances of this kind of complication. So this was all about the erythroblastosis fetalis. I have explained in a very short because I want to take lesson. I want to explain the videos in very short manner. And in next lecture I will try to explain this in. I will try to, if there is a need of anything more, I will try to explain. But this is the main concept. If you open the book, then later all other things you can find. But this is the main thing. What I will explain within 1 minute again. This is the mother is RH negative, father is RH positive. When mother is RH negative, father is RH positive. First fetus will be RH positive because father is RH positive as per the genetics, law of genetics. Then blood will mix with the, then what happens? During first pregnancy, there are chances of fetal blood can mix with the mother. If it mixes, the mother will form antibodies against this RH positive antigen. RH positive antigen. When there is IgG antibody formation, that what will happen? So body is having no IgG antibodies. When during pregnancy is there, that these IgG antibodies will cross the placenta and destroy the RBCs of the second fetus. And what will happen? Immature RBC. When it destroys the RBCs of the fetus has to do what? Fetus has to increase the RBCs again. So there will be more production of RBCs from the liver and spleen. At the same time, there will be immature RBC production. Those immature RBCs are destroyed by the spleen, the graveyard of RBCs. Again, what will happen? That liver is overload. There will be the overload on liver. Liver is not able to produce all these. Liver has to produce one RBCs also, and liver there is production of bilirubin also. So liver, there will be high load on the liver. Bilirubin production will be also increased because RBC destruction will happen. That RBC destruction will produce bilirubin. That I will explain the short any other video how RBCs are destroyed and what are the components coming from the RBCs. But here you remember bilirubin is produced is coming out from the RBCs. RBCs having hemoglobin. Hemoglobin has a globin part and heme part, and in heme part there will be an iron and porphyrin rings and other globin part that's having alpha and beta proteins that we explain later. But here bilirubin will be increased. When bilirubin is increased, there will be excessive overload on the liver and there will be chance of liver failure. When there is liver failure, the liver functions will be altered. One of the main liver function is production of the osmotic proteins. Oncotic protein. Those proteins are what? Those proteins are albumin, and albumin is the main osmotic protein. It will maintain the osmotic pressure in the blood. When this protein is decreased in the blood of the fetus, definitely there is a chance of edema in the body. The edema occurs in the body and that causes hydropus fetalis, that is the excessive swelling of the organs of the fetus. Thank you so much.